Hey everybody, I'm Maggie and we're back on another segment of SRH Access, Facebook Live. Today we are doing our final session of Scoliosis Awareness Month and we have Chief of Staff Dr. Dan Sucato. Welcome.
Thank you. It's good to be here again.
We're excited because we were just talking and it's been a year since we've been doing this and doing the live stuff, so we're really happy to have you here and talk about everything scoliosis.
Yeah, well, it's time has flown, as we were talking earlier.
Yeah.
It's gone by fast. I knew it was at least 6 months, but a year is...
Yeah.
It's gone by fast.
It's been great.
It's been
so today we're really focusing on kind of what's going on innovation-wise with spine treatment here at the hospital. So to get started, we really want to talk about our Center for Excellence in Spine, which maybe you can kind of explain how our centers are kind of set up, and then we can kind of dive into spine specifically.
So the Center for Excellence in Spine Research was the first one that was developed about 15 years ago. And the concept is trying to bring lots of different diverse expertise to the table to say, number one, how do we take great care of patients? How do we continue to do that well? And how do we do better tomorrow what we're doing today? And through many, many things, including research efforts. And so the research part of it is really important. And so it was really developed with that goal in mind. And we've had monthly meetings through the years and trying to bring topics, various important topics to the meeting and speakers within the organization, but also outside the organization to say, how can we do better tomorrow what we're doing today? And sort of, to me, it really answers a lot of the clinical questions and research that we do. How do you answer this particular challenge with a research effort to make it better? And so that's the whole concept behind it. And we have lots of different people with lots of different backgrounds, lots of different talents, lots of different strategies to improve upon the things that we're doing.
Definitely. And so, you're maybe touch on, too, all those involved. I mean, we obviously have the doctors on the clinical side, but then we have all these researchers that, are in the lab, as well as research coordinators doing all these things to really, like you said, enhance how we're treating.
Yeah. So there's several layers of it. And so you have the surgeons. On the physician side, you have the surgeons, you have the anesthesiologists, you have the neurologists. So we have an incredible neurology team that supports the neurophysiology team. And the neurophysiology team is in the operating room with us. So they're monitoring the spinal cord every second that the surgery is happening from the start to the end. And so when we're doing spine surgery for scoliosis or kyphosis, we're really stressing the spine and the spinal cord. And so as we straighten the spinal cord has to stretch and has to accommodate within the spinal canal of the bones the correction that we're achieving. And so the spinal cord is monitored at a very, very high level, state-of-the-art level. We do that all in-house, which is unusual for many institutions where they sort of farm that out to another organization or company to sort of do that monitoring. And those monitoring teams, our monitoring team is backed up by a neurologist here. So on the physician side, you have that group. We have the researchers, and the researchers come from biomechanical engineers to molecular geneticists, to histology folks, to bone biology people, to sort of really bring their expertise to the table. We have other clinicians like the orthotists that are there, physical therapists, occupational therapists, anesthesiologists. So it's a big group effort to sort of, if we have a question, can that question be answered through a multidisciplinary team? So that's really the concept behind it.
And that's so cool to think, too, because, I mean, if you think if you're a parent coming here and your kid has something going on that you're really concerned about, that there's this whole team behind just the clinical care that's even looking further into that condition.
And that's a good way to look at it. On the surface of it, you have if you're coming for surgery, you're having surgery, but below that, there's this huge layer of people who have looked at everything to make sure that there's no stone unturned. That if there's an issue that happens, that we have an algorithm to kind of take care of that issue, and we've sort of really thought about it way in advance so that everything's done ahead of time, and so it's safe and it's an effective procedure, because these are risky surgeries to a certain extent, and so you have to mitigate or limit that risk as best you can.
That's great. Can you kind of explain I know that we have a lot of studies that go on, and especially in spine, that really are looking at long-term and kind of looking at data and how, as a doctor, how you're looking at those and maybe how that affects like you said, the future of how we treat.
So we have an incredible team of clinical research coordinators, and we have several data registries where patients are, as they come to the hospital and they're being seen in their normal clinical course, we take very good care of them, but they are also asked, can we collect this data in a research setting? We're not going to change anything we do, but we need to collect the data so that we can look at large databases. Big data is a term that's used out there, and we've been doing big data for a long time, and so we've accumulated for idiopathic scoliosis, as an example, thousands of patients that we can look back and say, on this specific question, what is happening? And I'll give you a specific example that we went over this morning. We looked at the incidence of transfusion of blood products for patients with idiopathic scoliosis. And so we have thousands of patients, and we look back at 500 of those patients in the last 3 years. And we said, what are the reasons that patients get transfused? The transfusion rate is very, very low here. How do we make it lower while maintaining safety in the patient? Because transfusions, they carry a little bit of risk, although very, very safe. We want to limit that as best we can. And so using that data repository, if you will, to sort of ask that question allows us to very quickly, within a 2-month period, come up with an incredible study that looked at all the variables that go into the incidence of transfusion. So our clinical research coordinators are a huge part of the team, and they help us answer these questions.
That's great. I know that you guys are traveling all over the world as well as locally to kind of talk about and share research and expertise. So can we kind of get into some of like the medical associations that people are part of? So we have SRS, POSNA, that kind of thing.
So, it's really, we think we do things really well here, and we do lots of research, and then we want to share that research with others. At the same time, we also want to garner information that other institutions are doing. And so we're very active in many organizations. The primary ones are the Scoliosis Research Society, so the SRS, which is an international society that has about 1,500 members throughout the world. We've had a really strong presence there through many, many years. I've been here 20 years, and I still remember my first meeting in 1998 when I went to the meeting. It was in St. Louis, and this is just lots of good research that's presented. We have 6 surgeons that take care of scoliosis here. We've all had very strong leadership positions within the SRS, so there's many committees that we've chaired, been a part of. Steve Richards was the president of Scoliosis Research Society about 4 years ago. So we've had really strong leadership roles in that organization. POSNA is Pediatric Orthopedic Society of North America. That's really the pediatric orthopedic society that North Americans belong to, as the name implies. And again, same thing, leadership positions there. So Steve also was president of that. Lori Carroll was the first woman president of that organization about 3 years ago. Several I sit around the board of trustees today. And so there's lots of involvement in those organizations. And it's a lot, we learn a lot. We teach a lot. But if you do it right, you'll learn a lot. And so there's lots you can learn from every institution, how they do things. And you may use what they do, or you may say, that doesn't fit for our organization. But it's a constant learning process. And so, for example, Dr. Ramo and I were just in Ireland.
Oh, wow.
And we were invited there to speak at their meeting. And we gave several lectures, but we also sat and learned. And so we learned about how they manage patients from a post-operative as they're discharged home, how they're managed with their patients, whether they use narcotics, how much narcotics they use. And so it's a constant learning process.
Yeah, and that just even goes into like our fellowship program that we have and how we're training people here, and then they're going to these institutions, and it just is so great because we know that children everywhere are going to be treated really well.
Yeah, impacted by that. And you're absolutely right. Actually, the folks who invited us were former fellows who had trained here. Some just trained here 2 years ago. Others had trained here about 22 years ago.
Wow.
So, and there was another one that was trained somewhere in between, so about 10 years ago. So it's a great way to interact and a great way to kind of stay up with what people are doing, and we kind of see what they're up to, and they teach us and we teach them.
Yeah.
So it's great.
That's awesome. So let's kind of get into some of the resources we have with our spine program. So I know that we have a 3D printer here. So can you kind of describe what that does and the role, and then we can kind of show some of the models? Yeah,
just to give you a little background. So when I was training, we focused a lot on just the x-ray looking for the back. And so, it's a three-dimensional sort of curvature, but we really sort of focused on the left to right position. And then the X-ray from the side sort of came into play a lot. And then recently, we purchased something called the EOS machine, which I know we're going to talk about. And the EOS machine basically puts those two images together and can create a three-dimensional object, a three-dimensional image of that spine. That's one of the advantages. The other big advantage is that it's very, very low radiation. The third is that you obtain both the X-ray from the side and the back with the patient standing in the same position, and it's obtained at the same time. So those three things are really important, especially the low radiation. So every spine patient has the EOS if they're old enough. Some children who are really young get intimidated by a machine, so they can't necessarily stand within it for long enough for it to take the image. So that's important. The 3D image, then, we oftentimes get a CT scan on the really complex cases, and we have a 3D printer here at the hospital. In our research department, Karen Standifer has been the leading force in doing that and creating these images. So, for example, or these models. And so this is a patient with idiopathic scoliosis, a little peculiar pattern, but not that peculiar, but has a sort of a triple curve pattern. So you can see here's a curve here, and then a lower curve, and looking at it from the front, you can see the curve. So the nice thing about this is it allows us to sort of sit this on our desk and, for 2 or 3 weeks before the surgery, sort of look at it, really understand the anatomy really well, and in our minds at least, put together the surgery and sort of do the surgery before we do the surgery. So for a case like this, it allows us to sort of see, well, where are we going to strategically place the implants, how are we going to use those implants, and so that's really important. A little bit more of a bigger curve is this one, and so this is a congenital scoliosis where there's an abnormal shape to the vertebra that creates scoliosis. And then the most severe ones, and this is where it's useful, is a model like this. And this is a young boy who's very young. He's 4 years of age, and he has a really severe deformity. He came from another state and really significant, and he's been in traction. But this shows us many little details of his anatomy and allows us, again, to plan the surgery ahead of time and really think about it. And the other thing is I bring this to the operating room. We put it in a sterile bag, and it's actually sitting with me, and I can look at it and sort of find detail. So another resource that helps us to be very effective but also very, very safe.
Yeah, that's great. Let's go back to, you were talking about the EOS machine. Is this something that, in terms of, really, you were talking about the low radiation, and that's what's the really big benefit of it. In terms of how long a patient is in there, is there a difference between how long they're in the EOS machine in comparison to a normal MRI?
Yeah, so if it's so this is plain radiography, so it's like a plain X-ray. So if you compare that to the sort of standard X-ray, standard X-ray is done pretty much instantaneously, but it only obtains one view. And so you have to the technician has to readjust everything, and the patient has to turn and get readjusted for the